Hey guys, how's it going? I'm Adam, and this is Making a Difference. I hope you're safe and healthy and isolated. If you had asked me 15 years ago what keeps me up at night, I would have said rats. But I also would have said climate change, because Leo told me so, and I believed him. And before that, I would have said a global health crisis, because my dad, a doctor and a public health expert, told me so, and I believed him. Bill Gates shares this concern and has been warning us to be better prepared for a global pandemic since the Ebola outbreak of 2014. The question is, why? Well, because global and public health experts told him so, and he believed them too. Now we all do.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
Pandemic preparedness means responding quickly and having strong health systems providing accessible care with sufficient resources. A pandemic affects the political, socio-economic, transportation, education, and financial systems in addition to the public health systems of a country. Health systems are built to care for tiny percentages of their population at a given time. Not this many. As of recording this, I am in day 6 of South Africa, my home's national lockdown. And it f***ing sucks. I know it does, but it's a key part of that term you've heard so much about lately. Flattening the curve, which by now you know means slowing the potential spread of the virus. There are 3 stages to a spreading disease. An outbreak, which affects a community or region bigger than a normal illness would. An epidemic, which is an outbreak that spreads across a country or spilled over into multiple countries. And a pandemic is the point at which that disease starts to spread across the world. So why do public health experts and Bill Gates think we are so underprepared for a global pandemic? Well, 3 things. Time, resources, and management. How quickly we respond to a disease can have a huge impact on the severity of its spread. And our health service capacity and the effective distribution of its resources has a huge impact once that spread happens. Containing the spread of a pandemic requires otherwise unusual global cooperation. And that is why the G20 had a virtual summit to decide how best to stop this virus. On Thursday, the 26th of March, after 500,000 cases had been confirmed. So, not soon enough. Really bad viruses are usually very contagious or very deadly. There's only ever been one virus that is both. The Spanish flu, and it killed about 30 million people, over 1% of the global population at the time. And the scenario we're so worried about is, what if we get something that bad today? That would be 85 million people. COVID-19 is very contagious like a common flu, hence the social distancing, but not super deadly like SARS-1, hence young people being stubborn about it. The coronavirus is actually a coronavirus. There have been a few. First, there was the SARS outbreak in 2003, and then multiple MERS outbreaks between 2012 and 2015. Both were less contagious, but much more deadly types of coronavirus. Access is always an underlying concern of development and public health efforts. In this case, access to medical services like hospitals, healthcare professionals, testing, good information and advice on what to do and what not to do. Do people without money or in remote areas or who don't have insurance or a passport have the access they need to stay safe, healthy, and cared for during a pandemic? As of recording this, there are 870,000 cases, along with 43,000 deaths and 170,000 who've recovered. COVID-19 has a mortality rate of about 1 to 2% that is obviously much higher for people above the age of 65 and much lower for younger people. Unless you're an immunocompromised diabetic, like me, or someone with HIV or TB, an organ transplant or cancer patient, or you have a heart condition, or even someone recently sick. That's not just old people. Never mind the smokers, drinkers, and drug users who already compromise their own immune systems. That's definitely not just old people. This is dangerous and we're all at risk, even if it's a small one. And that's why social distancing, self-isolating, and shutdowns are so necessary, whether you feel sick or not. Fewer are exposed to the virus, fewer will get it, and fewer will definitely transmit it to an impossible 2.1 people. You could be contagious for up to 2 weeks without showing a single symptom. This way, health systems won't be overwhelmed because we're using fewer of the beds, equipment, and healthcare workers that are so desperately needed right now. The doctors, nurses, community health workers, public health personnel, caregivers, first responders, and all those on the front line deserve our commitment. Another public health term for you: burden of disease. It's what it sounds like. The burdens of death and illness a disease places on a country, its economy, and their systems. The burden of COVID-19 is high. Don't be a burden. There are also unforeseen complications, like Italy's terrible initial response or Xi Jinping's government's underreporting of cases. Or Donald Trump's treating this like a Chinese hoax, the way I think he still thinks that climate change is. There are a lot of things global leaders and health organizations have done well and not so well. For all the good, bad, and ugly in our response, we're going to get through this and be stronger for next time. We need stronger health systems, especially in the developing world, better medical surveillance like case reporting and contact tracing, a dedicated and ready-to-go medical corps that is trained for crisis management and pandemic responsiveness, preparing military, police, and other first responders to help with the observation, management, and care of communities, better R&D focused on identifying, treating, and preventing likely disease outbreaks. We need our governments, international organizations, and global leaders to listen sooner and harder to the experts who warn us first. The global cooperation necessary to fight a pandemic doesn't just mean political leaders and health workers. It means us too. So stick to social distancing. Leave the personal protective equipment to the incredible men and women on the front lines. Keep yourself healthy and get a flu vaccine, exercise, and follow your government's lockdown guidelines. I promise they were not written by your probably disappointing elected leaders. They were written by public health experts and epidemiologists who know what they're doing. And this one is important. Be kind to yourself and to the people you're in isolation with. This is scary and unfair and way too big to comprehend. But for now, this is what it's going to take to get through this. The number of new cases, the most significant number in any disease management, will drop down from 20,000 new cases a day to a couple thousand and then a couple hundred. But it takes time and resources, and different parts of the world are at different stages in this health crisis. For all of us to get through this, we have to stay isolated from others in this global fight. But we are not alone. We're in this fight together, and we'll get through this the same way. Be safe, be brave. And for fuck's sakes, wash your hands. I'll see you guys soon.